Our Women and Children's Hospital providers and staff congratulate you on your delivery and welcome your little one to the world. We understand that every woman's journey to parenthood is different. However, many mothers have one question in common: what happens now? We have created this video series to address your questions and concerns. Throughout this video series, we will cover 11 general topics. This information may be brand new to you, or it may feel like second nature. Both are completely normal. Regardless of which group you fall into, we hope that you will learn something new. If any questions come up, please write them down and a nurse or doctor will come by to answer your questions later. You can also pause or rewind the videos as you see fit. You may have many questions about what happened during your delivery and what will happen next. We tend to focus a lot of our time on the baby during this period, which is obviously very important. However, we want to take this time to focus on you. The first topic we will focus on is what to expect during your hospital stay. Every patient stays in the hospital for at least 24 hours. This allows the pediatrics team to collect necessary blood work from your baby and ensure that the baby is able to pee, poop, and eat before going home. If you're a first-time parent, you had a C-section, or have certain medical conditions, your stay in the hospital will be longer. Your time in the hospital will allow us to ensure that your vital signs are good, you have birth control and vaccines if you desire, and your recovery is starting off well. Before you go home, we will ensure that your pain is well controlled, you are able to eat and pee after delivery, you can walk around with minimal assistance, and have follow-up appointments scheduled for yourself and your baby. If your baby is in the NICU, or if there is a specific discharge plan necessary for your baby, we will ensure everything is in place prior to discharge as well. It takes a large medical team of professionals, including doctors, nurses, and anesthesiologists, to ensure that you and your baby are happy and healthy. We also have lactation nurses who can help you to latch and feed your baby, arrange for a breast pump, and troubleshoot any breastfeeding issues. Many patients also see a social worker before discharge. The next topic will focus on your delivery and a discussion of possible complications. No two deliveries are the same. Every patient, baby, labor course, and delivery are unique. Some deliveries may feel very hectic and scary, while others are very calm and quiet. Some patients push only once, while others push for hours. Some deliveries are complicated, while others are not. Both are completely normal. Some babies stay with their parents, while others are taken quickly to the NICU. Some mothers deliver vaginally with no help, while others require instruments like forceps, a vacuum, or a C-section to have a safe birth. All of these situations are normal and common. There are many complications that could happen during a delivery. They can be confusing and scary, especially when discussed immediately after delivery. So we wanted to spend a moment to briefly explain each of these possible complications. First, postpartum hemorrhage means that you lost more than 1 liter of blood during delivery. If this happened, you may have received medications or procedures to stop the bleeding, or may have even required a blood transfusion. If you were told you had a hemorrhage, be sure to ask your doctor how much blood you lost so that we can be prepared in future deliveries. Second, chorioamnionitis and endometritis are infections inside of your uterus. These are often diagnosed after a fever and treated with antibiotics. If you have one of these infections, the pediatrics team may also want to monitor your baby for a longer period of time. Third, if you develop elevated blood pressure during or after pregnancy, this can be called gestational hypertension or preeclampsia. As part of this diagnosis, you may have headaches, vision changes, right upper belly pain, swelling in your hands or feet, or your lab values may fall outside of the normal range. While it is uncommon, if you have seizures along with elevated blood pressures, this is called eclampsia. Some patients with preeclampsia will receive magnesium to help prevent these seizures. Fourth, shoulder dystocia is when your baby's shoulder is stuck behind your pubic bone during delivery. If this happened to you, you may recall a very loud and scary moment right before your baby was born. In a shoulder dystocia, there is an increased risk of injury to the nerves and bones in your baby's arm. The pediatrics team will closely evaluate and monitor your baby for any injuries. If you had a shoulder dystocia, you have a 10% chance of this happening again in future pregnancies, and you can choose to have a C-section if you desire. We hope this information has been helpful. If you have further questions, please speak to your provider. For insight about what to expect during your recovery, please watch the next video.